Thank you. Good morning, or I should say, buenos dias, amigos. I'll tell you that I was in Ecuador many years ago, and my wife and I had a memorable time because somebody recommended that we go to a nightclub in Quito by the name of Pachamama. I guess it means Mama Earth. And we heard the most wonderful music for about 3 or 4 hours and watched the Ecuadorians dance. Unbelievable evening, and I've never forgotten it. So I'm Earl Bergersen. I'm an orthodontist from the Chicago area in the United States and taught for many years at Northwestern, and I am the one that's responsible for all this stuff here that we're going to be talking about. So if I were to project or predict something, I have a feeling that sleep issues will be a tremendous aspect of dentistry, probably one of the greatest things in dentistry that's happened in a long time. There have been very few things that have really influenced dentistry over the years, and I'm old enough that I've experienced most of them. The first one probably was the introduction of fluoride in children's teeth. When I go to Europe and I show pictures of American children's teeth, they cannot believe how few fillings there are in these teeth. And recently we've developed some appliance systems that can help young children in a tremendous way with sleep problems. Sometimes they're as young as 2 years of age and they have sleep problems. In fact, 51% of young children at that age breathe through their mouth at night. Breathing through their mouth causes all sorts of problems because even a ½ inch of opening can close up the airway by 6 millimeters, and they might only have a 7 millimeter airway, which means that they're trying to get 1 millimeter of oxygen into their lungs, and it's deficient for them. The oxygen then interferes with REM sleep, which is the sleep that's required to repair the toxin that's produced by the brain during the day, and they do not get sufficient recovery at night for the next day's alertness that they should have. It also affects the immune system. It affects the endocrine system. There are 600 hormones in the body, and deprivation of sleep can cause all sorts of terrible consequences for the young child. So we have a questionnaire that we give to the mother or the father of a child, and they fill this out and give us some degree of the symptoms and their severity that the child has. And it's amazing. Some children, out of 27 questions, they might have 17 or 20 of them that they're being affected by. ADHD, bedwetting, difficulty in school, particularly with mathematics. But young children, for example, are resistant to discipline. They're hyperactive. They wake up constantly at night. They're a restless sleeper. Sometimes they might wake up 10 times in the night and wake their parents up each time. And parents tell me that they haven't had a good night's sleep for years because of the child's problems with sleep. So we give them an appliance, and this is called a Toddler habit corrector. And this can prevent mouth breathing. It encourages them to breathe through their nose. It enlarges the upper arch. It can correct habits such as swallowing that they've developed, maybe by prolonged use of a pacifier or nipple bottle feeding. And so we want those things to end by 6 months of age, and then an appliance can correct this so that we get improvement in the child's behavior and these other symptoms before they ever start school, and they can perform better in school as a result. Children, we had one 18-year-old girl, for example, that was did not want to go to college because she wet her bed. She wore the appliance one night and her bedwetting stopped, and she told her mother she now wants to go to college. We've had other children. I had a 22-year-old that came up to me that had sleep difficulties for as long as she can remember. She was under 7 different medications for about 10 years.
All the templates that said you have this, you have this, you have this. And I was just like, okay, I started at 4 and I just went through my timeline and it was so crazy. I've done sleep apnea tests, I have a constricted airway, I've been studying myself for 3 years. And he just figured me out in 24 hours.
She woke up every morning with a headache, severe headaches where she couldn't go to work or perform. She had a photographic memory, and yet she flunked mathematics. She could not pass mathematics.
Straight A's and everything, but I failed math. I had a math tutor from up to the time I graduated college. I failed math text 3 times. I couldn't pass high school.
The lack of oxygen affects the mathematics area of the brain, and there's no other part of the brain that can substitute. And during the day, the brain feeds into the intercellular space a toxin called beta amyloid. Interestingly enough, that same toxin is found in excess in adults with Alzheimer's and dementia. We put this appliance in, we tell the child to wear it only at night while they sleep, and it prevents mouth breathing. It encourages them to breathe through their nose so that they will have a better sleep and more complete sleep. So we start out with an appliance. Usually it's called the Toddler Habit Corrector, but if the child is, say, 5 years of age, we might start out with that appliance. It's an advantage to start out before they start school so that they have better performance in school. They could listen to the teacher better and so forth. But we also continue with other appliance systems that can also prevent mouth breathing, that also can prevent the mandible from relaxing and going distally into the mouth, which also pushes the tongue against the pharynx, which closes up the pharynx. So this appliance is either of 1 or 2 types. The first one here is called the Night Guide or HealthyStart Kids. There's another appliance that's in that system that can be used as well called the CSeries. Either one of these appliances can be used depending on whether the first permanent molars have erupted or not. These appliances then are used in order to continue with the sleep modification. If the child has not corrected a lot of their symptoms, they might continue with this appliance and wear one of these appliances only during the day for about 2 hours passively. Only 1 hour passively at night is enough to correct most orthodontic symptoms that they have. So what we're going to do with these appliances is to put that in, and it will guide the teeth that are erupting into the mouth, guide them into their proper sockets, and in the process will expand the adjacent teeth next to them. So we can get an average of about 4 millimeters of arch expansion in the lower anterior segment and 6 millimeters in the upper. Well, there have been cases where I have gotten 8 millimeters in the lower arch and 9 millimeters in the upper. That's more than the width of one upper lateral incisor. So this appliance will enlarge the arch, and this enlargement even goes back as far as the most posterior molar. So they get an enlargement of the palate, which allows them to breathe through their nose much more easily. But also this appliance can advance the mandible. So when we advance the mandible, that is a permanent correction. And so we can permanently correct their problems with sleep deprivation. So here is the CSeries appliance, and this is used for several different problems in the child. Crowding and rotations, overbite, overjet, gummy smiles, temporomandibular joint, and over 95% of these children are corrected with these symptoms according to a major research project that was done at Turku University in Finland. So it's only worn while the child sleeps. So here's a child that has a severely rotated lower right lateral incisor, and with passive wear of the appliance, you can see how the tooth has come in perfectly straight. Now this tooth has been straightened without adult collagenous fibers having formed around this tooth. So once the tooth is straightened and it comes under occlusal forces from the opposite arch, it stimulates collagenous fibers to form. These form all the way around, all the way down to the root end of the tooth. and this stabilizes the tooth. So it's the reverse of orthodontics in a way. It permanently changes this tooth, so relapse is at a minimum for this child in the future. So here's a child with a rotated upper right lateral incisor. And you can see that the appliance has gradually brought that in. And so the final result on this slide shows the lateral in place, only passive wear while the child slept at night. There's an overbite. Overbite in the deciduous dentition is going to increase by about 2 millimeters by the time the child is 12 years of age. We only correct the overbite and overjet to about 2 millimeter severity at this age in order to allow for future vertical and horizontal growth of the mandible. What happens also, you might realize, that it automatically corrects only what's wrong. If you have a deep overbite and it corrects it to the proper amount, the treatment stops. The appliance won't correct it any further. And if the appliance is used in a case where they do not have overbite, it won't correct it. So it's kind of automatic. You don't have to worry that the appliance is going to overcorrect the case. So we are interested in any child of a young age that has 1¼ millimeters of overbite or more. So a lot of children are candidates. In fact, 80% of children have overbites that are greater than 3 millimeters at about 12 years of age. So here's a child with a severe overjet. Anytime we have an overjet that exceeds 3 millimeters, we feel that this is a candidate for this procedure. In fact, from research, we find that 93% of young children are candidates for this. But not only are we going to correct the overjet with mandibular advancement, but this is going to open up the airway for a young child so that they can breathe easier and get more oxygen into their lungs and are able to exhale the accumulated carbon dioxide as well. Gummy smiles are an aesthetic change that we can induce for correction in a child. This child has a severe gummy smile, and any gummy smile that exceeds 2 millimeters is probably going to have a gummy smile as a 12-year-old. So if we add about 3 to 4 millimeters to the deciduous overbite, this tells us how much gummy smile we can correct. This girl does not have much overbite, but on the other hand, we can correct about 4 millimeters of that gummy smile with that degree of overbite that she has, and you see the final result shows really no gummy smile for that child. About 25% of adults have gummy smiles. Most of them are in women. 75% are in women, according to research. So it is a common problem. Most young children do have gummy smiles, but if it doesn't exceed 2 millimeters, it will self-correct. Then we have crossbites and class 3 tendencies. We can correct these as well. This child wore an appliance to get the crossbite corrected, and not only that, but she advanced the incisors to be in proper occlusion with the lower incisors. This brings the maxilla forward and allows the airway to be increased. TMJ, we find that there's about a 540% decrease in TMJ problems among children as they reach 12 years of age. And this compares the TMJ with a child that wore one of these appliances compared to a child that did not wear the appliance. And the black line is actually what the correction is with orthodontics. The problem with orthodontics is that at times we're going to be correcting particularly a female after the joint has already shown characteristics of being abnormal, and so that it's much more difficult to correct a bend. But at a young age, it's easy to prevent. So let's go to the next appliance. We now talk about what we call the HealthyStart CSeries. We have discussed this for you, and we've told you what we can get from this appliance. And we usually will use 2 appliances with this system. The second appliance is used as the laterals on the lower come in. The first appliance is used as the 2 centrals come in. There is an increase in size for the centrals. This is coordinated with Conrad Morhe's research out of Harvard University in the U.S. so that these appliances are perfectly coordinated with the increase in arch widths that occur in children that have perfect occlusion. So now the next appliance is called the HealthyStart preteen. This appliance is used from about 8 to about 12 years of age. It's used after the 4 lower permanent incisors are completely erupted, and we're a little bit more limited as to what it can do, how much it can correct. I get about 70% correction with this appliance, but it works very rapidly. It works about 5 times faster than braces, but it is very successful in correcting crowding up to about 4 millimeters. We can correct any severity of overbite and any severity of overjet, provided they have sufficient growth left. So we find that it can correct also about 83% of joint problems, similar to the earlier HealthyStart Kids appliance as well. We can correct rotations, crossbites. It's available in 13 sizes, 2 more sizes than the HealthyStart Kids appliance, which occurs in 11 different sizes to coordinate with the different sizes of the teeth. So each tooth has a socket for it. With the exception of the second deciduous molar, there is a slot in that area which allows the first molar to slide forward once that deciduous tooth is lost to go into a class 1 occlusion. This appliance is used up to 12 years of age. However, after 12, we have a third appliance in this system, which is called the OrthoTeam. And this appliance is adapted to be used in the permanent dentition after the second permanent molars have fully erupted. And this appliance is used to straighten out cases in the permanent dentition. However, because of the limited amount of space, because the deciduous molars have been lost at this time, there is less room for the teeth to be straightened. So our procedures in what we can straighten are a little bit less than what they are with the others. So we can correct up to about a 2 millimeter crowding unless we start to create space. So frequently these cases require other avenues of space gaining procedures, such as the use of bumpers or headgears, sagittal appliances, things of that order that can gain space for you as this appliance is used. Here's a girl that used a headgear, and the bow on the one side was moved way out so that one side moved a little faster than the other side, and the correction occurred in about 8 months for that person. So even if all permanent teeth are in, we can still correct. We've corrected cases up to over 60 years of age, provided they're not too severe. We can also correct crossbites. We can correct TMJs, but problems with the TMJ generally require lifetime retention, maybe 1 night a week for the rest of their life. If we treated it at 10 years of age, they would not need that. We did a research project watching younger cases 5 years after it was corrected, and every one of those children were corrected. So there's another appliance that we have called a Class 3 Corrector. This appliance is designed to correct pseudo Class 3s, which are end-to-end occlusions that slip into a Class 3 as they come into place. We can correct or minimize really skeletal Class 3s so that they are not as severe later on. One size fits all. It distalizes the mandibular dentition and advances the maxillary dentition and advances the premaxilla as well. There is also an appliance called the Snore Cure. This appliance is used in the adult dentition, and that just about completes the number of appliances that we have. I hope this has given you some idea of a summary of what's going to be covered for you today. I'm sorry that I'm not there in person for you, but I'm hoping that this technique will give a lot of Ecuadorian children a new lease on life and a better health style for them for the rest of their lives. We've treated probably over 3 million children at this point with the various appliances that we have in 36 countries, not only in the United States, and we hope Ecuador will be one of these. And I certainly have enjoyed talking with you, and thank you so much for your attention.